If you're on Social Security benefits, listen up. There's breaking news. The government just announced the second largest premium increase for Medicare for 2026, and the headline says it all. Medicare Part B premium will eat a large chunk of your Social Security collar in 2026. I am going to bring you the full details of the breakdown on what the Center for Medicare Services announced today. Record premium increases for Medicare. Plus, President Trump gave an update today about his $2,000 stimulus check. He said clearly when he plans to send the check and who is eligible in terms of income limits. So, stay till the end of this video. I am going to explain this important news about the stimulus check that the president has been talking about all year and you guys have been asking me questions about. Now, I have an update to give you. My name is Wami Quad. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance topics that affect seniors and their retirement and benefits. So, if you are new to my channel, welcome. I am glad you're here. Do me a quick favor. Go into the comments and let me know your city and your state. Now, if you've been watching my channel for a while, welcome back. I am glad you're here. Thank you for your continued support. We have a lot to cover, including the stimulus update that I'm going to give you at the end of this video. So, stay till the end for that critical news from the president. Let's jump into Medicare, because that's what's making news today. And let's talk about it. So this is USA Today with a headline that a lot of seniors are not going to be happy about. I am going to walk you through the 5 changes that are happening to Medicare. Number 1, Part A and hospitalization increase premiums. Number 2, Medicare Part B premium. Number 3, prescription drug coverage. There's been a lot of cost increases there. I'm going to break that down for you. Number 4, Medigap. Some Medigap plans have been eliminated, and so I'm going to tell you the most popular Medigap plan right now that you need to be aware of. And then number 5, many changes to Medicare Advantage plans. Let's dig right into it. But let's start with this USA Today article that I am talking about. It says that it's official, and that's what the headline says. It's official. Medicare cost will eat up much of older Americans' Social Security cost of living increase next year. And it says that the standard monthly premium for Medicare Part B, which covers outpatient care, doctor services, and durable medical equipment and preventative services, will be $22.90 in 2026. The Centers for Medicare and Medicaid Services said on November the 14th that is up $19, $17.90, or nearly 9.7% from the $185. It is smaller than what was originally forecasted. But here's the kicker. It is the second largest dollar jump in the program's history, behind 2022. So what does this mean? Seniors were the only ones who saw an increase in poverty in 2024. All age groups saw a decrease or stay the same. So it means that even though poverty among seniors is on the rise, the government continues to pile on cost increases. That makes the life of seniors much more difficult. And when you think about it, they give you a 2.8% cost of living adjustment increase, but then they want you to accept a 9.7% Medicare price increase. Make that make sense, because how can the same government say that inflation is down? And so you should accept a 2.8% cost of living adjustment for Social Security, a $56 increase. But then the same government turns around and announces almost 10% increase in your Medicare premium, and then does not give you an explanation of why your Social Security check should not also go up by 10%. That is the problem that I have with this announcement, because I think seniors are being squeezed again by the government talking from both sides of the mouth. On one side, they're telling you inflation is down, so take 2.8% in COLA, and then on the other hand, they're telling you healthcare inflation is up, so we're going to charge you 10% more for your healthcare premiums. That is unfortunate. But I will keep moving on because I can go on a tangent and rant about this all day. So let me share what I came here to share with you today, which is break it down for you what this means for you. So here is what it says. It says the public is likely to perceive this Medicare Part B increase as taking a significant chunk or even most of their COLA, said Mary Johnson, an independent Social Security and Medicare policy analyst. In other words, another continuation in relentless cost increases battering consumer finances. I could not have said it any better. That is exactly what is happening because the government wants us to believe that everything is good, and then they give you a 10% increase in your healthcare cost, and that is just unbelievable. So how does this affect you from a program-by-program level? I'm going to go to Kiplinger and share with you their breakdown of what this means for various parts of Medicare. So it says specifically what you will pay for Medicare in 2026. So I am going to dig deeper and then we're going to talk about it. So let's start with Medicare Part A deductible. All right. So Part A deductible for hospital admissions increases to $1,736 in 2026. That's an increase of $60 from $1,676. The premium Part A inpatient hospital deductible covers beneficiary share of cost for the first 60 days of Medicare, covered inpatient hospital care in a benefit period. So that is a cost increase for patients' hospitalization for more than 60 days. The co-insurance amount in 2026 is $434 per day, up $15 from $419 for the 61st through the 91st day of hospitalization. So essentially, they're saying that you don't want to get sick and you don't want to go to the hospital, because if you go the first 60 days, you have a co-insurance to pay of $1,736, and after 60 days of staying in the hospital, the first each day from 60 to 90, you're going to pay $434 all the way through day 90. And then it goes up again after the 91st day. You are going to start paying $8.86 from day 91 through day 100. So it escalates. And remember, Part A does not cover long-term care. So, we're just talking about hospitalization and what you are going to pay during a hospital stay. Before I go any further, guys, if you want to stay on top of all this breaking news that are happening at a record pace, then you should join my text list by texting the word INSIDER to 4432-930080, and you'll be added and join thousands of seniors that are getting 1 or 2 text messages from me each week, letting you know of critical updates like this one that are happening that could affect your budget, your finances, and your retirement. So text the word INSIDER to 4432-930080. It is free of charge. There is no charge for joining this text list. And the benefit to you is that you will stay updated on critical news and breaking news information that you need to be aware of. Now let's go to the next piece of information. Medicare Part B premium. So Medicare Part B premiums are going up. In 2026, you're going to pay $22 up from $185. So that is another increase. And that is a 10% and almost 10% increase for Medicare Part B premiums. And of course, if you make more money, you are going to pay more. So Medicare Part B for higher earners is even higher than what I just shared with you. Now let's talk about prescription drugs. Prescription drug coverage is also going up. The average premium for Part D standalone, which covers drug cost, is expected to go to be $34.50, and that is down from, $38.31. So that is the only good news here, is that you are getting a slightly lower Part D prescription drug cost. Now that is just the monthly premium. The maximum PD deductible is set at $615. That's an increase of $25. So the deductible is going up. And then the out-of-pocket cost is also going up by $100 from $2,000 to $2,001. So while your monthly coverage is going down, your deductible is going up, and then your out-of-pocket maximum is also going up. So that is Medicare Part D premium. Next, we're going to talk about Medigap. Medigap doesn't. Medicare doesn't cover everything. If you're on original Medicare, you will need to buy a Medigap plan. So private insurers offer Medicare supplements, insurance or Medigap policies that cover deductibles and co-payments. These policies are categorized by letters A through N. All plans offer the same benefits no matter where you live or which insurance company you buy the policy from. Every policy that goes by the same letter must offer the same basic benefit. Usually the only difference is cost. Now, due to the phasing out of the popular Medigap Plan F, Plan G is now the plan of choice for many. So it is important to understand if you choose a high deductible Plan F or Plan G, you may be expected to pay a deductible of $2,950 before your policy pays anything, including co-insurance, co-payment, and deductibles. I know that's a mouthful, but the most important thing you need to know here is that Part Plan F are being phased out. Plan G is now the popular Medigap plan if you are on original Medicare. And then finally, let's talk about Medicare Advantage. Medicare Advantage plan is an alternative to original Medicare, making Medigap coverage unnecessary. Medigap plans are sometimes called Plan C. If you join a Medicare Advantage plan, you still have Medicare, but you will get a Part A and Part B coverage from your Medicare Advantage plan. So, what's happening with Medicare Advantage? Well, the average monthly premium will decrease from 14 to down from 240 to 16 in 2025. So there is a little bit of cost saving there. But unlike original Medicare, Medicare Advantage plans have a maximum out-of-pocket cost, and in 2026, it is $9,550 for in-network and $13,900 for out-of-network. So that is another cost that you have to consider when you're talking about Medicare. Now, I know this is all a lot. And so guys, as I've been saying all year, I am on a mission to help 100,000 seniors get peace of mind about Medicare this open enrollment season. Why? Because I want to educate you around Medicare. I want to share with you the best resources to be able to help you to be able to get on the best plan, because there are so many changes that are happening to Medicare, and I want you to get the plan that you deserve. And so I have been sharing with you that you should call Chapter, our partner that has helped over 3,500 of our viewers get the peace of mind that I'm talking about. Don't take my word for it. I'm going to share with you testimonials from people like you who have called Chapter and what they are saying. Viewers like you who watch my channel that have called Chapter and been able to get help, important help, so that they have peace of mind going into next year about Medicare. Here's the first one. I'm listening to your channel from Stockton, California. I want to thank you for recommending that we call Chapter during this open enrollment period. I called them and they have helped me choose a better plan. So now I am set for the new year. Thanks again. That is one review testimonial. Here's another one. It says, "Thank you very much for sharing the Chapter information. I called over the weekend and was able to register for a different Medicare Advantage plan that had all my doctors and covered my medications." So it makes me happy to hear that. So you can see that I went in and liked the comment because, let me show that to you. Yeah, right there. I like the comment because this is what I'm trying to do to help 100,000 seniors get peace of mind about Medicare. Here's something that I have been saying about Chapter. They are not there to sell you anything. They are there to help you figure out if you are in the right plan. And if you're not, they'll help you switch to a better plan. And this person did exactly that. He said, "I just reviewed my Medicare through Chapter, and they told me I was in the best plan for me already." That's great. And if that's you, at least you know for sure because an expert, an unbiased expert, has told you that you are in the best plan. It means that next year you know for sure that you have the coverage that you need that meets your needs. I'm going to read you two more. Here's another one. It says, thank you for the advice. I called chapter I signed up for Signar. He said I took your advice and I called chapter I signed up with Signar. I previously had human. This was better planned for me with Signar. I signed up 10 days ago. Thank you for your help. And I responded right back that is great to hear. I am so glad the information was helpful to you. So guys, that is the peace of mind I am talking about. Here's one last one. It says, thank you for commenting this information. I reached out to the number and they found me such a better plan for 2026. I just wanted to say thank you for helping those of us who are out there trying to figure things out. Have a blessed night. So guys, you're hearing it from people like you who have called chapter and gotten that peace of mind I'm talking about. So call them today. These are the guys you'll be talking to, ready to help you figure this out. Call 539-205-2147. I'll put it in the description and in the comments to this video. And if you want them to call you, then fill out the form that I'm going to include in the description and comments, or go to askchapter.org/insider. All right, so finally, let's talk about President Trump and his stimulus update. The president is saying that he's still determined to send you the stimulus check, and now he has given us a timeline. So, let's talk about it. So, it says President Trump stimulus check update. Trump details timeline for 2,000 direct payments. Let's get right to it. This happened today, right? Today, November the 18th at 9:03. I'm recording this video at 2:17 p.m. on November the 18th. So let's jump right into this news. So it says that President Trump said that his proposed $2,000 tariff dividend payment to Americans are likely to come next year. We are going to be issuing dividend later on, somewhere prior to, probably the middle of next year. That is the president speaking directly to reporters. A little bit later than that, thousands of dollars for individuals with moderate income, middle income, while speaking to reporters in the Oval Office. Why does this matter? Well, Trump has drawn attention to revenue generated by the wide-ranging tariffs. He's saying that tariffs have brought in record amount of money and he wants to send the American people money. Trump has repeatedly floated the idea of giving Americans a check from tariffs, which he said on Monday have generated hundreds of millions of dollars. He has said the checks will be given to lower or middle-income Americans, and the Treasury Secretary was asked about who would qualify, and he said anybody getting or making less than $100,000. Now, a lot of people have asked me, do seniors and people on disability qualify? And the answer is yes. Because when this was proposed originally, it said it was going to be similar to the stimulus that was received in 2020. And here is what it says. It says it will be similar to the stimulus in 2020, and it will include every man, woman, and children. And so it even gave an example that a family with children and what the children will get when it was just $600 initially, and now it has grown to $1,000. So that is the two pieces of information that you need to know about. One, that it is happening next year before the middle of the year. And number two, anybody getting less than 100,000 qualifies. And as I have said in my previous video, how do I believe this is going to happen? Do I believe it's going to happen? If the president keeps talking about it, then yes. Because if anything that we've learned in this Republican Congress, if the president wants something and he keeps talking about it and makes it a priority, they're going to give it to him. And so if you want to figure out whether this is going to happen or not, do not listen to me. Listen to the president and watch his words. If all he talks about is stimulus, then you know it's going to happen. If he talks about it once and moves on to the next thing, then you can have reasonable suspicion of whether it's going to happen. So, that's what I'm going to be looking up for, and I want you to do the same. So, that is all I wanted to share with you today. If you like what you heard, hit the like button, hit the subscribe button, and I'll see you tomorrow in another video.